Good evening. My name is Doug Voegeli. I'm the Director of Environmental Health with the Public Health Department for Madison and Dane County. Tonight I'm going to just talk briefly, give an overview of the PFAS, per and polyfluorinated alkali substances.
I just wanted to say something else quickly. Is this the presentation that you gave to Diener before?
There are changes. It is a little bit different because as studies and data and everything comes in, I'm trying to keep it updated.
You had given the presentation to Diener, which is the Environment, Agricultural, and Natural Resources Committee.
Yes.
Okay,
Yep.
great. Thanks.
Yep.
Sorry to interrupt you.
Yep, no problem, no problem. So I want to talk about three different ways that PFAS are impacting us here in Dane County: surface water, groundwater, and then also our fish that are in our lakes here. So just really quickly, a quick chemical lesson. PFAS are per and polyfluorinated alkali substances. The structure is right up here. This little head here changes, and it changes the structure of the substances, as well as the chain of fluorines there will change as well, and it changes the structure of the PFAS. So you'll hear people talk about 8-chain, 6-chain, 4-chain, different size chains. They were produced commercially, started in the 40s, really ramped up in the 50s. And then on here you can see peak production was from 70 to 2002. Mainly talking about two different PFAS compounds here, PFOA and PFOS. There are over 3,000, but that actually has been 4,000 and it has been 5,000. So it's very easy to get more substances. You just change that head, put something on there, make the chain longer or shorter. So there's thousands and thousands of these compounds. And can be more and more. They're great. They're great compounds for fire resistance. They're great compounds for waterproofing. They're oil and stain water resistant and everything. So they were used quite a bit. They're in your Gore-Tex, Teflon, different things like that, used on a regular basis. The two compounds, PFOA, PFOS, are no longer produced in the United States. They were voluntarily banned, so we don't see PFOA and PFOS so much anymore. But that doesn't mean that there's not still PFAS substances out there. There are, and they are just changing the name on them on a lot of times. And you may not think it's a PFAS substance, but when you start looking at the longer name, it is a PFAS substance. So again, they're used predominantly non-stick coatings, waterproof fabrics. Your Gore-Tex, Scotch guarding all has PFAS in it. Food packaging, that's what makes it oil and grease resistant when you get that Big Mac that is not leaking on your lap or anything like that. The specialty firefighting foams, the aqueous, it's called AFFF, aqueous firefighting foams. Again, that was primarily used for oil and petroleum fires, and it just puts the foam over it, completely extinguishes the fire in a matter of seconds. And then coated paper as well. So as we have all heard, if we've been reading the newspaper or anything recently, these are called forever chemicals. They don't break down very easily. And then some of the longer chain ones may break down, but they're just going to break down into the shorter chain PFAS substances. They're found at a lot of different sites, mainly airports where there is training with AFFF, around military bases, etc. And then they also do bioaccumulate. They bioaccumulate in fish and wildlife.
People.
So the primary routes of exposure include eating food that's packaged in PFAS-containing material, eating the fish that are caught in waterways with PFAS, drinking water that's contaminated with PFAS, and then any incidental ingestion of dust or soils with PFAS. A lot of that's more around the industrial areas where there's a lot of PFAS coming out the stacks of companies and settling in that area. Again, and then in consumer products. So it does collect in people. I think I heard that out here. Yeah, PFAS substances are found in probably, I think they figure like 98, 99% of us. So most of us in here have PFAS in our blood serum. The most of it is the PFOA, PFOS that's been measured. And fortunately, it has been showing a decline in our serum over the past few years of those two substances. But again, remember, we're talking 4,000 or 5,000 substances. So, health concerns. There are a lot of health concerns with PFAS. Causes issues in the thyroid, increased cholesterol levels. It reduces the efficacy of vaccines, so we could be vaccinating, and PFAS will reduce the efficacy of those vaccines. And it's also been linked to decreased fertility in women. A lot of the studies that have looked at the health concerns of PFAS have been done on animal studies, and only really, again, when we go back and look at the two substances, PFOA, PFOS, are the most studied and where we have the most information about the health concerns with PFAS. Again, we're talking 3,000 different substances, so there's still a ton of study to be done on all the substances that are still out there now. And it will take years and years. So some things that we just got to keep in mind. They're widely used, stay in the body for a long time. There's a variety of health risks that are associated with a high level exposure. We're going to talk a little bit in here about well 15, but right now at this point in time, well 15 in the city of Madison is turned off. The city of Madison has also done a lot of other testing in their wells and has found it in other wells throughout the city of Madison. Some substances, a variety of different substances, depending on what well it was. So the Department of Health Services recently sent the DNR the interim standards for PFOA, PFOS of 20 parts per trillion. And they are also looking at 20 other substances that the DNR is asking DHS to look at. So DHS starts pulling all the studies that they can together, and then they start reading through them, and then use their knowledge in the studies to help come out with a standard that would work. And they'll send that back to DNR, and then DNR starts the rule-making process, which I think I read today that they are starting the rule-making process on the PFOA and PFOS interim guidance that was sent to DNR. Also, just recently, actually last Wednesday, I think, excuse me, a new fish advisory came out for Lake Monona. So hopefully, we'll talk about it in a little bit here, but the fish advisory does change the amount of fish meals that you can eat safely. So I just want to touch on some of the monitoring that is happening. I'm just going to talk here about Madison Water Utility and the testing that was done in their wells. It's important here to note that the testing for PFAS started in 2012, but there was nothing found. They did another sample and test results in 2015 on all wells, and there was nothing found. ND means no detect. Down here, though, the reporting limit is 10 to 90 parts per trillion. What we find then in 2017, as the method changed, the reporting limit and the precision of the laboratories got much better. So now they can report down to 2 parts per trillion. Now we found it in 2 wells in Madison. So then it was checked again in 2018, and again was found in those 2 wells, 15 and 16. If I recall correctly, I think that we have PFAS substances that have been found in 10 out of 23 of the wells in the city of Madison. And they are the ones that are doing the most testing. We don't see a lot of testing coming from the other public water systems at this point yet. And then this is just to give you some idea of like the well 15 area where people will be drinking predominantly well 15 water. I think it's in possibly your area of supervision. But just that area there is the people that are getting most of the water from well 15. And again, well 15 is turned off. This is a very busy chart. It's got a lot of numbers and a lot of different things on it, but this is just to show you that there are a lot of different standards throughout the United States. The one, I can't even see it now, do I have it on here? The EPA guidance, the health advisory level for the EPA is 70 parts per trillion. Well 15 with all of the these 5 PFAS is at 34, and you can see some of the other levels in different states. New Hampshire just came out. These are changing and dropping quickly with different states as they are going through the rulemaking process and as they're finding more information out about PFAS. Here's where Wisconsin came in at 20 for PFOA, PFOS. Right now at well 15, for those 2 substances, it's 12. So this is just to kind of show you that there's standards all over the board across the United States in terms of the PFAS and how they're being regulated. All right, I'm going to switch gears here a little bit and start talking about fish sampling. Fish sampling was done in October of last year, of 19. There was an attempt earlier on in the year, but the water levels were so high that the number of fish couldn't be caught to get a good sample. So they did another sample in October and were able to get enough species. These are all the PFAS that were found in the fish, and right here PFOS is the one that is used to base the fish consumption advisory on. It is the one that accumulates the best in the fish and would be found in the highest concentrations in the fish. Another thing I want to point out here too is when we're talking PFAS, we're talking parts per trillion. These numbers here are in parts per billion. So just to kind of give you an idea, these have to be multiplied by 1,000 if we want to compare it to parts per trillion and parts per trillion. And I'll show you some slides where we'll talk parts per trillion. I'll make sure that you know that the standards that we were looking at before, these are all in parts per trillion. So when we start taking these numbers, multiplying them by 1,000, we're talking some pretty high levels of PFAS in the fish.
The standards before for drinking water? In the chart before?
Yeah, they were for, these standards are for groundwater.
Groundwater.
Which is different than drinking water, which is different than surface water. So these are in the tissue of fish. This is Starkweather Creek here. And then there is also results for Lake Monona. So up here, these are bluegills and largemouth bass. So again, these have to be multiplied by 1,000 to get parts per trillion. So again, some pretty fairly high concentrations in our fish.
Excuse me, Doug.
Yes?
Can you hear him okay?
Yes.
You're hearing him all right?
Yeah.
Doctors? Okay, just want to make sure.
All right. So based on the fish tissue sampling and the results, the DNR changed the fish advisory for Lake Monona. Only for Lake Monona and Starkweather Creek, they called it a special advisory. So the special advisory, it can get really complex and difficult. So to make it simple, this is really where we're looking at. 1 bluegill meal per week. For anybody, doesn't matter, women, men, childbearing, child, anything, 1 bluegill meal per week. 1 meal of any other species per month: carp, catfish, bass, northern walleye, and perch. So there's other species that weren't tested, so it remains the same, because they weren't able to catch those species. So when there's additional sampling done and other species are caught and analyzed and the results come back, they'll be added to either the 1 meal per week or the 1 meal per month. I'm just going to show this. This is what it looks like when you go to the actual DNR website to pull up the advisory for Lake Monona. And it gets a little confusing, but you can see it's still saying the same thing: 1 meal per week for bluegills. These are species that haven't been tested yet, so they're still allowed at one meal per week. Same thing. So they divide up anywhere throughout the state. The advisory is broken up between women, childbearing, and children under 15, and men and older women. So that's how it breaks out. It's not the easiest to understand. I think the easiest to understand is 1 meal of bluegill a week, and anything else 1 meal per month. And then this is just the same thing for Starkweather Creek. So that's the new fish advisory. It's changing, and then we'll be. I'll talk a little bit later about how we adjust to that as the public health department and as the county and city. I also want to just touch base on some surface sampling that was done. These are all sites that were sampled for PFAS, and the results are right here. This is, I tried to fit it all on this screen. These are the samples numbers, and these are the levels. They're in parts per trillion here. So high, but not as high as in the fish, which makes sense when you think about bioaccumulation.
Where's 10?
What's number 10?
That's right by the prisoner pit.
Right here.
Okay.
Is it at Truex?
Coming out
Yep.
of the airport.
Oh, so
I
that's,
think this is Anderson right here.
It's where,
Anderson
it's where
Street.
MATC has their firefighting training facility.
Yeah.
It's just down.
Okay, thank you.
Yep. So these are the results from the surface water sampling. Surface water, for our purposes, for public health purposes, really you can swim and be in the water and everything. We just don't want people swallowing the water or anything like that, or getting it, say, on their animals, where their animals are licking it or anything. We just want to make sure that we're not ingesting the surface water. Foam. I don't know if you can tell the difference here, but you can kind of see the difference between the colors here of a naturally occurring foam and a foam that is PFAS foam.
That's not correct,
So-
by the way. I'm a foamologist, and I checked it out.
All right, I get my information from DHS,
I
so
understand.
that's what
I'm just telling you,
they're putting
having
out.
investigated it.
So the PFAS is a bright white coloring, and it's usually lightweight and will blow pretty easily across the lake or the stream if needed. And it can blow inland, and this will accumulate more in the bays and the eddies, and will smell differently than the PFAS foam.
Don't be smelling the foam.
All right, a couple things that I just want to point out here. These are the current signs. We put these signs up per the DNR's request to just get the information out to people so that people are aware of the PFAS that is in the water in Starkweather Creek. This here is the same sign at Obrick Park. This is a fish consumer advisory sign. This is no longer valid because the advisory has changed. So these signs will need to come down. These signs will also be replaced. These signs are saying we're waiting for the fish tissue results. We have those, so we'll make those adjustments and put new signs up around We have 34 spots along Starkweather Creek where we have signage. That's where we do most of the signage, but we will take and expand our signage and make sure that we're hitting access points around all of Lake Monona, and then we'll work with the city of Monona to ensure that we're getting the access points in that area signed properly. So the signage, we do have to run by DNR to get their approval. So this is how you can reduce exposure to PFAS. Avoid eating contaminated fish, which we know now that the fish in Starkweather and Lake Monona are considered contaminated, and the advisory has been adjusted. Make sure that you're dusting and vacuuming your surfaces properly. Limited eating food from treated paper and packaging products. Is very difficult for us to do that because everything we get is in some sort of a treated paper product. And again, showering, washing dishes, or swimming in water isn't going to be increase your exposure. It's not a very good, dermal is not a very good route of exposure. So the next steps, DNR is going to be pulling additional fish samples. They're going to pull from some more from Lake Monona. I think they're going to go into the Brigham Park area, as well as Lake Wingbrook. And as I stated earlier, they started the process for rulemaking on those two compounds, PFOA and PFOS. Department of Health Services is reviewing 20 additional PFAS at this point in time. So we'll have 22 out of 3,000 by December of 2020, which there's been people suggesting that we look at this as a class, but some of the compounds vary in toxicity. So it'd be very difficult to look at it as a class.
They're all bad.
Community meetings on fish consumption. We've got 2 meetings scheduled. I've got some handouts there, and we'll be doing whatever we can to get the information out to everybody on these meetings so that we can talk to people. We're particularly interested in populations that are subsistence fishing. So we're doing our best to make sure we're outreaching those populations. And we will be sending out letters, postcards to advertise to hopefully get as many people as we can to these meetings so we can talk the fish consumption. We have a website that we're trying to collect and hold all of the information here. And by all of the information, I mean from the airport, from the DNR, from DHS, from the MMSD, another player in PFAS, and then as well as any health information that we can. So we're trying to push everybody to this website so that all the information is out there and available for everybody. This probably goes without saying. Additional studies are needed for PFAS overall. We have over 4,000 substances. Only 2 really have been studied to any extent. And we need to have more studies on these compounds to actually know the impact on our health, as well as the impact on our lakes and our fish.
Okay.
Questions?
Thank you, Doug. Sorry, I just want to fit in everybody who wants to speak, so I'm going to ask commissioners if you could email Doug your questions, because we've got 12 people who want to speak, so I want to get those people in. And then your phone number's there, email address, and then I want Amy, you to speak.
Sure.
If you could go up next.
Sure.